Center for Family Health Chief Operating Officer, Sara Benedetto, and from Lifeways, Director of Integrated Health, Amy Cosgrove-Evens. Welcome.
Thank you.
Good morning.
Thank you for having us.
Good morning.
I guess the first question is what is integrated health?
That was my question.
That's a really good question.
Sure.
You want to start us off?
Sure.
Amy?
So integrated health is our services at Lifeways. It is a focus on prevention, wellness, and holistic care. So it focuses on not only the mental health services that we provide, but behavioral health as well as physical health.
Mm-hmm. Whole person wellness is the end goal, correct?
Absolutely,
correct. How does this partnership help you with your clients and patients get to that end goal?
Yep. So I'll have Sara just kind of talk about the long-term partnership that has existed, and I can chime in.
So we've been great friends and partners with Lifeways for a number of years, and our current integrated health clinic, what I think is so great about it is that it gives our patients an opportunity to get their medical care and their mental health services in the same location. And our staff are literally co-located, working in the same space together.
That's
so
great.
it really creates a lot of communication between the provider staff, and it helps the patients have better coordinated care and better health outcomes.
Yeah, it seems like it's a win-win for the patients, right? One less
Yes.
step.
Absolutely.
Right. They can get all of that. They can get their blood work, their labs taken right there. There's not X-ray there, but they can get their labs drawn, all their point of care tests, education. The providers can talk if they need to adjust medications. Any of the care management kind of things that happen between visits. Our staff work really closely together to make sure patients get what they need.
Communication is so key, right, with one's health, and providers communicating to each other. Things can potentially get lost in translation. This just helps streamline everything. It's great.
Absolutely.
Yeah.
And sometimes people will focus on one aspect of health and wellness and not the other. And so by having this partnership, they're able to come and have their primary care needs met, their physical health needs met, as well as their mental health.
It was always, and I think that just, historically we as a society we've segregated physical care and mental health care. We've had hospitals and mental hospitals.
Yep.
That has contributed to the stigma that surrounds mental health care, hasn't it?
Absolutely.
I think
Absolutely.
so. Yeah, and I think another benefit is, sometimes patients have a place that they're more comfortable. So in this case, patients that are utilizing Lifeway services are really comfortable going to that space.
Right.
So instead of saying, here's another space that you have to go to, why not just bring that primary care to them so they can get it in a place that they're already comfortable.
Right.
So that's another benefit, I think.
Right.
Absolutely.
As well.
Did you learn about mental health in high school?
I
don't think I did.
remember anything from
Yeah,
high
I
school.
don't think I did either. Yeah, it's just something that wasn't talked about for a long
No.
time, I think. So.
No, and I think I just saw there are ways that you care for yourself, including mental health. In addition to your diet and exercise, there are mental health things you can do to have a better quality of life and extend.
Absolutely, absolutely. There is a significant correlation between overall health and wellness and prosperous, productive life. Yep, absolutely.
How does someone take advantage of your services at Lifeways? Do they need a referral, or what do they do?
They do not need a referral. They can call our primary 517-789-1200 number to get connected to services, but they can walk in any time that our doors are open. They can come in initially just to for an initial screening and stay for an intake and get connected to services in one visit.
So you have patients already at Center for Family Health who may be able now to integrate their healthcare with Lifeways. Do they start at Lifeways? Do they start
It could be either place, but the way that we have this set up, which is also unique, and is that the Lifeways team, the Lifeways employees actually manage, if you will, the schedule for our medical provider. So they know who's a consumer of Lifeways, and they can actually put that patient on the schedule. If we have someone that we think is maybe coming to our downtown location already, but they maybe would benefit, we can certainly call and say, hey, is this person's a consumer at Lifeways and they'd like to switch and get their care there, then that's how we work together
I think the first thing you partnered on, you actually had a clinic at Lifeways.
We did, and we still do. The original clinic that we had was open full time. Was open to anyone in the community. The challenging part became there wasn't always, if someone from Lifeways, a consumer, needed access that same day, or there wasn't the same level of coordination because our schedule was full with just general folks in the community. This is much more focused on being a consumer at Lifeways in order to see our provider that is housed at Lifeways, and it's 3 days a week that we're there.
That's great.
That we have her there.
And you actually have essentially an emergency department at Lifeways.
So we have 24/7 services now. We have a CRU service, which is a crisis residential unit. We still work and coordinate with hospitals, but in the event that a person is in need of care or treatment and there is not a bed available in another facility, then we can house them currently on at our site.
And I think overall we're getting the impression that over the last few years, because of the pandemic and social upheaval and political unrest, that there are more folks who are suffering with mental health issues.
I would agree. I would agree. I think we've seen a significant increase, and we continue to see increases, but that's what we're there for, and we're hoping that people will reach out, make contact, come in, get the help.
What's a good way to talk to someone about mental health? Recommending maybe they talk to someone. What's a good way to approach that?
So I think that sometimes people think that mental health is not as simple as just needing to talk with someone, just needing to take a few minutes to care for yourself, make sure that you are just stable, grounded, rounded, comfortable with where things are at. As far as coming in and looking for support, I think just calling and having the conversation, asking the questions.
Yeah, that's the first step. Yeah.
I think it's also, I think more and more you'll see your primary care physicians are much more comfortable at being sort of another entry level point. So everyone, there's so many different ways, right, that you can reach out. You can talk to your provider, you can talk to a school, someone at your school for your youth, and then getting connected to the many different ways that you can get access to mental health. It can't be done in just one way, right? Because it's not one size fits all. So there's lots of different opportunities. And
Amy, you have special sessions, events, scheduled activities that the community can participate in.
We do. So we focus on prevention as well as wellness, and we have a variety of programs, and I'll leave this here for you, but we have things like Stress Less. These are programs that are drop-in opportunities. We have pop-up exercises programs around the community. We were out at Shellett Park in the winter. We're at the mall, and these are just activities to get people out, keep people moving, have conversation and build connections with other people who are focusing on health and wellness. So we have a Balancing Wellness, which focuses on the 8 dimensions of wellness, including emotional, spiritual, intellectual, physical, environmental, financial, occupational, and social. So there's a lot going on, and truly our focus is about prevention and then bringing about wellness as well.
That sounds like a wonderful continued partnership, and walk-ins always welcome, right?
yes, always have walk-in, and actually we work with Lifeways on the weekends even. I know we've reached out to your crisis team if there's something that comes up and it's outside of the typical hours, so our walk-in is available.
Sounds like it could be a lot to navigate for a patient or a client. Do you assign someone that's going to hold their hand through the process?
There are many support people in roles to help. We have community health and wellness workers who will help direct and make sure that people are connected to the appropriate services. We have case management services at Lifeways, and so depending on what a person's needs or desires are, we can make sure that they have people in place to help direct them.
Well, it's great that we have this continuing partnership. It was great hearing more about it today.
Great.
Yeah, thank you both.
Thanks for having us.
And people can still get their school physicals before.
They
Oh, yeah.
still can get their school physicals.
They need
Call
to do
today.
that.
You can get in right today. Yep.
From the Center for Family Health, Chief Operating Officer Sara Benedetto, and from Lifeways Director of Integrated Health, Amy Cosgrove-Evens. More of the morning show after this.